So here we are at Lugano ICML 15 conference 2019, and I'm presenting data on the TRANSCEND CLL clinical trial, which is a phase 1 study of Juno CAR T cells, lysocell, in patients with relapsed refractory CLL. Patients needed to have failed at least 2 or 3 lines of therapy depending on the risk category that their CLL was in, and everybody needed to have failed some BTK inhibitor, happened to be 100% ibrutinib. Progression cases, we had patients with majority of advanced stage disease and high-risk disease, so bad-acting patients, and more than half had also failed venetoclax, so really bad-acting CLL patients. They all got Juno CAR T cells or lysocell, and we found that there were very few high-grade toxicity events, mostly having to do with cytopenias related to the lymphodepletion chemotherapy, but there was one patient with grade 3 cytokine release syndrome. Actually, I take that back. There was 2 patients with grade 3 cytokine release syndrome and 5 patients with grade 3 or 4 neurotoxicity, but all was reversible and manageable. We did find that as early as the 30-day first assessment, response assessment time point, patients had achieved up to almost 70% overall response rate with undetectable minimal residual disease, also up to 60–65% cases. And we found that at the 6-month mark, these overall response rate and undetectable MRD rates were fairly similar, so there was some stability of the responses over time. In fact, 5 of 6 patients in a complete remission at 6 months have stayed in a complete remission at 9 months, and 3 of those patients are now out more than 12 months, remaining in a complete remission, undetectable MRD, and actually having persistent CAR T cells as well. So short follow-up, median follow-up of about 9 months. We need to follow them longer. We need more patient numbers. Total number of patients on the study thus far is 23 across 2 dose levels. So we certainly need to keep following these patients. But for patients who had relapsed after multiple novel therapies, I think this is an excellent result for those patients.